There are 5 specific bills the federal government has either capped, drastically reduced, or eliminated for Americans over 65. When I say eliminated, I mean the law was changed, the protection was written in, and the bill should either not exist or be a fraction of what it is. Most seniors watching this are still paying all 5, in full, every month. Before we go further, let me address the 2 reasons people click away from videos like this. First, you think this is only for struggling seniors, the people with almost nothing saved. You're comfortable, so you assume it's not for you. Second, you think it's for wealthy retirees only. And since you're living on Social Security and maybe a small pension, you figure your income is too low to matter. Hold both of those for 20 seconds, because this list is for both of you. Some of these wins are biggest for the person on a fixed income. Some are biggest for the retiree with a paid-off home and a solid nest egg. I'll tell you which group each one helps on every single bill. The institutions collecting these bills have every incentive to stay quiet. Your Medicare plan isn't going to call and explain the federal program that would eliminate your monthly premium. Your hospital's billing department won't lead with the fact they're legally required to reduce your bill if your income qualifies. They keep cashing checks. The program exists, the money is funded, the law is in effect, and it stays right where it is until you claim it. My name is Daniel Whitaker. I'm a certified financial counselor who has spent 15 years working exclusively with retirees on the cost side of retirement. The bills, the premiums, and the government programs that most people never hear about in plain English. 5 bills. Let's go. Bill 1, your prescription drug bill. For decades, there was no ceiling on what a Medicare beneficiary could spend on prescriptions in a year. Seniors on cancer drugs, heart medications, or diabetes treatments could spend $5,000, $8,000, $12,000 out of pocket, and nothing in the law stopped it. Drug companies and insurance plans priced accordingly. That is over. As of January 2026, Medicare Part D caps your out-of-pocket drug costs at $2,100 per year. Deductible, copays, coinsurance, all of it combined. Once you hit that number, your plan pays 100% for the rest of the year, no exceptions. If you are spending $4,000 a year on medications, your bill has been cut in half by law. If you were spending $7,000 or $8,000, common for seniors on specialty drugs, you've had thousands of dollars permanently removed from your obligation. The drug companies now absorb that cost. This isn't income-based. It applies to every single person on Medicare Part D, regardless of income or assets. That's the win for everyone. But there's a second layer for lower-income seniors, a program called Extra Help, also known as the Low Income Subsidy. If your income is at or below 150% of the federal poverty level, roughly $22,500 for a single person, or $30,000 for a couple in 2026, Extra Help can eliminate your Part D premium entirely, drop your copays to $4 to $12 per prescription, and waive the late enrollment penalty. Action steps. Go to Medicare.gov and use the Plan Finder. Enter your exact medications and see what you actually spent last year versus the $2,100 cap this year. If your income is near the Extra Help threshold, apply at SSA.gov. It's free, takes under 30 minutes, and if you qualify, the savings start the month you're approved. Bill 2, your Medicare Part B monthly premium. If you're on Medicare, you pay a Part B premium every month. Doctor visits, outpatient procedures, lab work. In 2026, that's $202.90 per month, usually deducted automatically from your Social Security check. It's so invisible that most people never ask whether they actually have to pay it. Many don't. A set of federal programs called the Medicare Savings Programs exists specifically to pay your Part B premium on your behalf. The most comprehensive, QMB, Qualified Medicare Beneficiary, goes even further. It eliminates your Part B premium, your Part A deductible, your Part B deductible, and all Medicare cost sharing. If you qualify for QMB, providers are legally prohibited from billing you for any Medicare cost sharing at all. None. Eliminating the Part B premium alone is worth $2,434.80 per year. The income limit for QMB in 2026 is $1,350 per month for a single person, $1,824 for a couple. There's a standard $20 income disregard, so a single senior receiving $1,370 in Social Security lands right at the threshold. Your home doesn't count as an asset, neither does your car. The asset limit, $9,950 single, $14,910 for a couple, only applies to liquid assets, like bank accounts. If you're slightly above QMB, two other programs cover just the Part B premium. SLMB covers singles up to $1,616 per month. QI covers singles up to $1,816 per month. Here's what frustrates me most. The application isn't at Medicare.gov. It's at your state Medicaid office. That mismatch is where most people stop. They hear Medicaid and assume they don't qualify. To be clear, the Medicare savings programs are not full Medicaid. Your doctors don't change, your coverage doesn't change. All that changes is who writes the check for your Part B premium. Search your state name plus Medicare savings programs to find the application. The outcome, if you qualify, is over $2,400 a year that simply stops being deducted from your Social Security. Bill 3, your hospital and medical bills. Every year, American seniors pay billions of dollars in hospital bills they were not legally required to pay. Two federal protections, both fully in effect, were simply never explained to them. Protection 1, the No Surprises Act. This law took effect January 1st, 2022. Before it, you could have an in-network surgery, everything properly arranged, and then receive a bill weeks later from an out-of-network anesthesiologist or radiologist, sometimes for thousands of dollars. Almost everyone just paid it. That practice is now illegal. The No Surprises Act prohibits out-of-network providers from billing you above your in-network cost sharing for emergency services or for non-emergency care at an in-network facility when you had no real choice of provider. If you received bills after January 2022 that violated this, you may be entitled to a refund. Think about how many bills arrived at your home in the last 3 years. A meaningful number of them may have been illegal charges. Protection 2, Hospital Financial Assistance, Section 501R. Most hospitals in the United States are nonprofits. In exchange for their federal tax exemption, the law requires them to maintain a written financial assistance policy, offer free or reduced cost care to qualifying patients, publicize that policy, and apply it before sending any bill to collections. Almost none of them volunteer this information when they send you a bill. Here's what you do. Before paying any hospital bill, call the billing department and say exactly this. Do you have a financial assistance or charity care program, and what are the income limits? They are legally required to answer. If your income qualifies, and thresholds often start at 200 to 300% of the federal poverty level or higher, they must reduce or eliminate the bill. For lower income seniors, full forgiveness is highly likely. For middle income retirees, significant discounts on large bills are common. For everyone, the bill is not final until you ask. Bill 4, your monthly home utility bill. The federal government has run a program called LIHEAP, the Low Income Home Energy Assistance Program, since 1981. Congress funds it annually. Every state receives an allocation and uses it to help qualifying households pay heating and cooling bills. In 2026, the average benefit ranges from $400 to $800, with high energy cost states like Massachusetts and Minnesota providing substantially more. Eligibility is generally at or below 150% of the federal poverty level, about $22,500 for a single senior and $30,000 for a couple. Many fixed-income seniors qualify and have simply never applied. To apply, search your state name plus LIHEAP or call a local community action agency. Benefits go directly to your utility account. Now here's the second program, and this one I want the comfortable retiree to hear specifically. It's called the Weatherization Assistance Program, WAP. It doesn't pay your bill. It does something permanently better. It sends a professional energy auditor and a licensed contractor to your home at no cost to you to physically make your home more energy efficient. Insulation, air sealing, heating system upgrades, smart thermostats. The average value of work done is $5,000 to $7,000 per home, and the result is a permanently lower utility bill for the life of the improvements. The income limit for WAP is 200% of the federal poverty level, about $30,120 for a single person and $40,880 for a couple, reaching into lower middle income retirement. And there's a third layer available to everyone, regardless of income: utility company discount programs. California's CARE program cuts bills 20 to 35%. Dozens of states have equivalents. Most states also require special protections for elderly customers, including notice before disconnection and hardship provisions during extreme temperatures. One phone call to your utility company. Ask, what assistance programs do you have for customers over 65? That question alone has saved people hundreds to thousands of dollars a year in bills they assumed were fixed. Bill 5, your Medicare IRMAA surcharge. This one is specifically for the comfortable retiree, and it generates the most anger when people find out they've been paying it on a salary they stopped earning. Here's the problem. When Medicare calculates your Part B and Part D premiums, it doesn't look at what you earn today. It uses your tax return from 2 years ago. For most people, that lag doesn't matter. But for someone who recently retired, it's a financial trap with a name, IRMAA, the Income-Related Monthly Adjustment Amount. If your 2024 income was above $109,000 as a single person or $218,000 as a couple, Medicare is adding a surcharge to your premiums right now in 2026. That surcharge ranges from $81.20 to $487 per month extra on Part B, and $14.50 to $91 per month extra on Part D. At the highest bracket, the total annual surcharge reaches $6,936. Picture this, you earned $130,000 in 2024 and retired in January 2025. Your income drops to $35,000. But Medicare pulls the 2024 return and charges you a surcharge based on income you haven't earned in over a year. Without action, you could pay that surcharge for up to 2 full years after retirement. The fix is a form, SSA 44. The full name is the Medicare Income-Related Monthly Adjustment Amount Life-Changing Event Form. Retirement is explicitly listed as a qualifying event. So is the death of a spouse, divorce, or a significant income reduction. You fill out the SSA 44, attach documentation of your income change, a retirement letter, a current year income estimate, or a copy of the lower tax return, and submit it to your local Social Security office by mail, fax, or in person. SSA then recalculates your surcharge based on current income rather than the 2-year-old return. A recently retired single person who was earning $130,000 could eliminate nearly $1,000 per year in Part B surcharges alone, retroactive to the month you file. The form is at ssa.gov right now. Free, no attorney needed, and the SSA will never send you a notice that your income dropped. They use what they have until you tell them otherwise. One more thing about this bill. It's invisible. It never shows up as a separate line item. It's baked into your Medicare deduction from Social Security. Most people assume it's the standard premium and never question it. That invisibility is expensive. The fix is a form and a 20-minute conversation. 3 bonus moves for the retiree with accumulated assets. If you're living entirely on Social Security with very little saved, you've already gotten the most valuable part of this video. These next 3 moves are for the retiree who has an IRA, a 401k, an HSA, or an investment portfolio. For the right person, any one of these can be worth more in a single year than everything above combined. Bonus 1, paying Medicare premiums from your HSA. If you ever contributed to a health savings account while on a high deductible health plan, that money doesn't expire. It rolls over indefinitely. Many people have years of contributions sitting in HSA accounts they've never connected to their Medicare strategy. Here's the rule. Once you turn 65, you can use your HSA to pay Medicare premiums. Part B, Part D, Medicare Advantage, or Medigap, and those withdrawals are completely tax-free. You contributed pre-tax, it grew tax-free, and it comes out tax-free when used for Medicare premiums. No tax at any stage. A retiree paying $202.90 per month for Part B and $34.50 per month for Part D spends about $2,844 per year on premiums. If you route that through an HSA instead of a traditional IRA or taxable account, you save your marginal rate on that amount. At 22%, that's $625 a year in real savings, just from choosing which account to pay from. Keep your HSA open. Pay your Medicare premium from any account, then request reimbursement from your HSA. Keep the receipt as documentation. The reimbursement is tax-free. Bonus 2, the 5-star Medicare Special Enrollment Period. Most Medicare beneficiaries believe they can only change their Medicare Advantage or Part D plan once a year during the annual enrollment period, October 15th through December 7th. Miss it, and you're locked in until next fall. That's not entirely true. Every year, CMS rates every Medicare Advantage and Part D plan on a scale of 1 to 5 stars. If any plan in your service area earns a 5-star overall rating, you are permitted to switch to that plan one time between December 8th and November 30th of the following year. Any day, outside of open enrollment, no qualifying event required. This matters if your current plan's performance has changed. Your doctor left the network, a key drug was dropped from the formulary, your premium jumped, and you missed open enrollment. If a 5-star plan exists in your zip code, you can switch right now. Go to Medicare.gov, use the Plan Finder, and filter for 5-star quality ratings. If one appears in your area, you can enroll today. Bonus 3, the 4-year Roth conversion window. The Big Beautiful Bill passed earlier this year includes a new senior deduction of up to $6,000 per year for people 65 and older, stacked on top of the standard deduction and the existing senior deduction. For a married couple where both spouses are 65 or older, that's $12,000 in additional deductions. For many middle-income retirees, this means taxable income in 2025, 2026, 2027, and 2028 will be at the lowest point of their entire financial life. And that creates a conversion window that retirement planners are moving quickly on. A Roth conversion moves money from a traditional IRA, where it grows tax-deferred, into a Roth IRA, where it grows tax-free forever with no required minimum distributions. You pay income tax on the converted amount in the year you move it. The strategy works because you want to convert when your tax rate is low, which is right now, so future withdrawals and any inheritance to your children are entirely tax-free. A married couple with $90,000 in combined income from Social Security, pension, and investments might, with all 3 deductions stacked, have meaningful room in the 10 or 12% tax bracket for a conversion. That same conversion done 5 years from now, after this deduction expires and RMDs have grown, might cost 22 or 24%. The difference on a $50,000 conversion is several $1,000s. On $100,000 converted over 4 years, it could be $10,000 to $20,000 in total tax saved. You'll want a CPA to run your specific numbers, but the window exists, it's open now, and it closes after 2028. Every year you wait may be a year you can't get back. In closing, every program I described today is real, funded, and in effect right now. The $2,100 drug cap is federal law. The Medicare savings programs are actively enrolling. The No Surprises Act is being enforced. LIHEAP has been delivering energy assistance for 45 years. The SSA 44 is on ssa.gov right now. The 5-star enrollment period is a documented legal right. The Roth window is open and counting down. None of this is automatic. The law doesn't refund you for a protection you never claimed. The government doesn't file the SSA 44 on your behalf. The hospital doesn't ask you about financial assistance. The utility company doesn't apply LIHEAP without an application. The whole system stays exactly where it is until you go claim it. That is not an accident. I put together a reference document, the Eliminated Bills Checklist, with the exact program name, income threshold, form number, and website or phone number for every item in this video. It's at marcusgraves.com/eliminated. Print it out, go through it with a family member or friend, and take action. The second most expensive pattern I see in retirement isn't people who never learned about these programs, it's people who watched a video, thought, I should look into that, and never got around to it. Before you close this tab, think of one person over 65 who would benefit from any one of these 5 things. A parent, a neighbor, a friend struggling with drug costs, a sibling who just retired and has no idea their Medicare bill is based on a salary they no longer earn. Send them this video. The odds are high they're sitting on one of these bills right now, overpaying it every month, and nobody has ever told them the law already gave them an exit. My name is Daniel Whitaker. I'll see you in the next one.